Okay. Remember, we don't have this training thing down yet. Okay, I said that months ago. We thought we'd have it down by December. Now I'm thinking January to February. Even though it's not down, I'm kind of pushing it ahead because we do think we're having an effect. Okay? As a businessman, I always try to get way out ahead of the curve because I think that's where you need to be. So a lot of times I'll spring something up not quite organized yet. I think that's better. Here's an example. Because we have had an effect. We're seeing conversions, everything going up. Wellness coordinators are starting to understand what to do a whole lot more. We had a meeting here 2 days ago. They were in tuned. They kind of knew everything that we were talking about. So we're getting there. Cool deal? But we're not quite there. That's why this is still a little bit disorganized. Remember, most people came back the last yesterday or Tuesday, and then Wednesday they did that too. Okay, you ready? Wellness coordinators. Okay, here's where we're going to start. Okay. We're going to start with the questions. You guys have to be solid on those questions. Okay. The two big questions are, how much does it cost, right? Is that the number one?
Yeah. Yep.
Okay. So the answer is never $29, is it?
No.
Okay. Because if you can expand on that answer, it's always better. Okay. So our first visit is only $29, and that's cheaper than most deductibles and copays. With that $29, you come on in, you fill out some paperwork. The doctor's going to look at your medical history. He's then going to ask you some questions on your problems, your pain. Okay, he's going to examine you. He's going to tell you what he found. Go over, what he found. He's going to treat you or adjust you, probably, if he decides that you're a good chiropractic candidate, which most of them that come in are. We turn down some patients, okay? He's going to explain to you what you got. More than likely, he'll send you home with some home therapies, home icings. If he determines you need an x-ray, he'll send you out for that or refer you out if it's not a case that we can handle. Most of our patients are seen without x-rays. Pretty good answer, huh?
Yeah.
You see how I expand on it? Okay, do you take insurance? Isn't that the second most, do you think?
Probably, yeah.
Okay, so it's not just a no answer, is it? Okay, no, we don't accept insurance except our first, see how I'm going right into the other, our first visit is only $29. That's cheaper than most copays and deductibles. With that, you come on into the clinic, fill out some paperwork. The doctor's going to look at the paperwork. He's going to ask you some questions. He's going to examine you. If he decides that you're a chiropractic candidate, he'll go ahead and treat you or adjust you. More than likely, he'll give out some stretches and some icing, some things that you can do at home also to get better. Okay? That's actually better than the first time I did it, right?
Yeah.
But you see the points that I'm getting in.
Yeah.
You got to get in the points that it's cheaper than most copays and deductibles. Because here's what's going to go on in the future. You know those are going to rise, right?
Mm-hmm.
Big time. Okay? And there's a lot of insurance out there that will pay, it might be a $75 copay to go in, or if, no, that's not common, but a $50 copay is very common. Well, and then they're only going to pay $30 of the chiropractic adjustment, so the 50 eats the whole thing up.
Yeah.
By the way, we're seeing chiropractors that are giving treatment plans $5,000, $6,000, $7,000. Okay? Yeah. Okay. So we don't do that. I think another question is, do you treat certain symptoms? Do you treat pregnancies? Pregnant women? Yeah, I think you guys know that. But here's one. Does a chiropractor treat eczema? That's a good question. Let me ask the doctor. If you don't know, that's a good question. Let me ask the doctor. You can either hold or I can call you back.
I've
Right?
done that a couple times.
That you didn't know what it was, or
Yeah.
Okay, so don't say yes, don't say no if you don't know. It's much better to ask the doctor. Does that make sense?
Yeah.
Okay, and by the way, does a patient like that?
Yeah.
Big
Sometimes
time.
I even get the doctor on the phone.
Exactly. And listen, I've done that before. And sometimes the doctor has to get on the phone because they need a couple questions.
Yeah.
Does that make sense? So, and I actually think that's a better way. Okay? Hey, do you treat lower back pain? Of course, a lot of our patients come in with lower back pain and we get good results with that. Do you treat headaches? Of course, right? Yeah, those are common, right? Of course, a lot of our patients have headaches. We get good results with that. Do you treat neck pain? Of course. A lot of our patients have neck pain. We get a good result with that. Cool deal?
Yep.
So, how much does it cost? Do you take insurance? Do you treat X? Now, I put does it hurt, but most of the wellness coordinators say they never really hear that.
Every once in a while, I'll
You'll
get
hear.
like a really timid
Right.
patient in, either one that's never seen a chiropractor or one that just doesn't like being adjusted but knows the benefits of it. And they'll ask me, and I don't really know what to say.
And does it hurt?
It's like a situational thing. I mean, it never hurts for me personally.
You say that.
Okay.
You say that. Okay, and here's what I would say. Sometimes you can get a little sore from the adjustment. Most people don't. Okay, most people do not get sore from the adjustment, but we have to tell everybody because the ones that do don't expect that, if that makes sense. So here's what I would say. Most people don't get sore with the adjustment. I personally had if that's your situation, I personally get adjusted. It's not sore for me. If anything you get, it can be a little bit sore from the adjustment. It's similar to doing a workout or working out at the gym if you're not used to it. You know, how the next day you wake up sore. So I think that's a good example of how to use that. The other thing that I would use, and I don't know if you guys are familiar with this, but you realize that chiropractors have the lowest malpractice insurance out of any physician. The lowest malpractice insurance.
That makes sense.
Doesn't it? Why does it make sense?
They don't hurt.
Exactly. We don't hurt. We hurt the least amount of people. Okay? And if we hurt you, you recover. We make the muscle sore, this or that, or the other things. Does that make sense? You're going to recover. If you go to the medical doctor and they hurt you, you could die. Okay, right? I'm not kidding. Okay? Now, if you're ever interested in this is serious. Okay? Research the amount of deaths by non-steroidal anti-inflammatories. Those are your aspirins, your Tylenols, your acetaminophen, and all those. So the deaths from acute rupture of an ulcer in the stomach, liver, and kidneys. How much do you think that is killing America? I'm certain, and this is researched, and this is from the medical doctors, by the way. It's in the thousands a year. Right?
That's how my dad passed away. He had an ulcer in his stomach that ruptured.
Get out
And
of
was
here.
he taking a lot of non-steroidals?
Yeah, he had a lot of medication. But
Right.
Yeah, I think those were
Right.
included.
So it's fairly common, okay? And it's in the thousands. So if you want, Google non-steroidal anti-inflammatories deaths per year. And if you can do that, Jim, while you're just doing it, we'll get that thing over there. So listen, does it hurt?
I can't even say what you said.
Okay, non-steroidal anti-inflammatories.
Got it.
So does it hurt? Sure doesn't hurt for me, okay? But some patients can get sore. It's similar to working out. Then you kind of get used to it, okay?
Sounds good.
And by the way, chiropractors' malpractice is the lowest out of any physicians. That's because chiropractors hurt the least amount of people. Cool deal? And this is probably, and this is a similar question you get when they come in the next day. How come I'm worse today than I was when I came in? Same thing. Some people can get a little bit sore before they start to get better. That's not uncommon. Okay, especially look, we're adjusting them and they're stretching. Even if you're not used to the stretching, you can get sore.
Yeah.
Okay, because you're doing something a little bit different with the muscles. Okay, so as they start to, and that tissue's being stretched and loosened up, it can be a little sore, similar to if I gave you and I put you in a yoga class with all stretching. Yep. Okay. Oh my God. Okay, you're sore, and all you did was stretch. You really didn't lift a whole bunch of weights or anything, did you? You just stretched. But I guarantee you, if you're not used to yoga, you do it one time, you're going to be sore. It's you're stretching tissue that's just not used to it. Okay, so use those examples, and I think the more examples you use like that, it's similar to working out.
More relatable it is.
Yes, the more
Easier
relatable to that.
understand.
Okay. Any other big questions that you have that they ask over the phone? Anything?
anything.
Any other big questions? So it's pretty easy. We got really 4 or 5 questions. What did you get the non-steroidals?
There's a Finnish test, 80,144 men in the Finnish prostate cancer screening trial.
Prostate screening trial.
Non-steroidal anti-inflammatory drugs, right?
Now I'll look that up, I guess. Yeah, but I want DES.
That's what I said. That's by. I keep getting that same trial.
Okay. Home therapy. Home therapy. I'll look that up later. You know about that though too. It's very high. Yeah, it's very high. It will stun you. Remember, the aspirin was only meant, in all those non-steroidals were only meant for 6 to 8 weeks or something like that. Don't quote me on that, but it's a short period of time. Mm-hmm. Do you know anybody that just pops it on a regular basis? Just because, have you known anybody? Yeah, she has. I've got friends that just pop them it's like a vitamin.
She's rolling backwards.
Huh?
She's rolling backwards.
Do you know anybody?
My grandpa takes an Excedrin, 4 Excedrin every single day.
Yeah, so.
I told him he needs to stop.
Yeah, or he needs to lower that. Now, he could be doing it for cardiovascular benefit, but that's too much. Mm-hmm. Okay, and that could rupture the stomach again. All right, home therapies. You know we're very, very big on home therapies, right?
Huge.
Huge. Do you know all the neck stretches and the lower back stretches?
I'll admit I don't know all of the neck stretches. I need to be shown physically.
Okay.
Looking at the videos even, I'll be like, what is he doing?
Right, no, you should be taught yourself. So what clinic are you at?
Schaumburg.
Get right at, who are you working with?
Dr. Aaron.
Get right on his butt.
Okay.
Does Dr. Aaron use you to show patients stretches?
No.
Really?
Neither does Chuck. He asked me one time in the past.
Because
I've
guess
seen
he
you
usually
last
does
time
something
he's
with
asked.
Okay, now Dr. Bodum said that if you're working with Dr. Bodum, because we can hand off in the back. Mm-hmm. Remember, we're doing that handoff in the back, right?
I've noticed that, the one time he did ask me to do it, it was a cleaner transition to the front for sure.
Really?
But I work with him on Sundays, just Sundays.
Okay, so he told us the opposite. He said that some of the wellness coordinators were relating to him, and I have no doubt that he's a good guy. He said that they were relating it was real clunky back there. If you don't know your stuff, it's clunky. Does that make sense? Mm-hmm. It was like in that front desk the first day. Were you smooth? It's clunky. Yeah. Okay? And he wanted to stop it. We're not stopping it. You guys have got to get confidence with it. Once you get confidence, it goes pretty quick, doesn't it? Because you're saying the same thing over and over and over again and showing them in a similar way over and over and over again. Okay, so when you get in your clinic, you have to say, Daniel's almost fired me. Okay? And it's your fault. Okay? And you need to teach me those stretches. And the only way, so you're going to review them on the video.
Okay.
Then he's going to teach you. Okay? And then you'll start working with some of the patients. Okay. And in about 2 days of that, you got it.
Yeah, once you actually do it with 4 or 5 patients, you've got it.
Yes. It doesn't take long, does it?
No.
It does not take long.
I mean, 3 minutes max to show them both stretches that they need.
Hug, come on, hug.
Get up here on camera.
In the hug, in front of the camera. In front of hug. No, you're exactly right. Now, comment on it was actually smoother. I want to comment on that, what you mean by that.
I don't know, I think it's just, I knew what to say and what to do.
But as you brought him to the front, what was smoother?
Just walking to the front.
The sail was a sail?
Yeah, the sail was definitely
Why do you think
smoother.
that was?
I kind of felt like she trusted me more.
Hug.
Another one.
No, on camera. Hurry up.
Now watch
wait, slow motion camera. Zoom, 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 zoom.
You're right. Hey, you're right. That's exactly what I was looking for. Okay, so here's what my complaint was before, right? That patient would come around the front and, hey, I'm recommending basically 10 visits. Oh, okay, we get 10 visits, we go this way, and we can go that way, and we can, right?
Yeah.
And it's right into the sale, okay? This way, and I was made fun of you guys, that what wellness coordinating were you doing?
Yeah,
You're selling. You're a salesman.
yeah.
You're wellness coordinating. When you do the back stuff,
You're more than that.
yeah, you're wellness coordinating, aren't you?
Mhm.
So here's what we want to do. Now we're also going to go to a sheet of paper with the instructions on it. So here, the doctor's going to be circling. We want the lower back stretches. I want it done 3 times a day. Okay, you're going to hold for 20 seconds. Okay? You're going to hold for 20
No, I'm moving the
seconds.
camera.
Yeah. And then underneath there, there's going to be special instructions. What's a special instruction? If a patient works out, I always want them to do the stretches after the workout. The reason is the muscle's a little bit warmer then, so you'll get a little more flexibility. I say you get a little bit better bang for your buck. So that's a special instruction. Does that make sense?
Yeah.
Sometimes I'll have a patient that's, man, I wake up every single morning painful. One of the things I want to analyze is how they're sleeping. Okay, if they're sleeping pretty good in a good position, if they're not, I change the positions obviously, but if they're sleeping in a good position and still getting sore, I'm gonna do the stretches right before they go to bed. Okay, to keep them looser at night, and I get a benefit on that most of the time. That, hey, I do feel a little bit better when I stretch at night. I hear that one all the time.
Mm-hmm.
If I have a patient that's at the computer all day long, special instructions, I want you to go ahead and start to stretch. Every hour at the computer. Hey, how'd you do with every hour? I felt better. Cool, let's spread that stretch out. Let's go every 2 hours. Hey, I did better. Cool, let's go over 4. Now I got sore after 4. We cut it back down. So you're going to kind of work with that patient on that piece. Does that make sense?
Yeah.
I get patients that get real sore in the lower back after sitting for a while. Guess what I want to do? So they're sitting like this. I love to give them McKenzie because it's getting them on the opposite way of the body. So
Yeah.
cramping up like that, we're going to open that
Stretch
up.
it out the other
Yeah,
way.
so I'll say, can you get on the floor? Some can, some can't.